Hi, and welcome back to Hey Doc, What's Up? We're doing our series on polycystic ovarian syndrome, or PCOS, and today what I want to talk about is infertility. Remember, PCOS is when a woman may be making some months of normal, appropriate aged female hormone, but many more months may be down at this type of level, making much lower and age inappropriate female hormone levels, while making higher male hormone levels, and in particular free testosterone. Well, that's not going to work well when you're trying for fertility. You're trying to get pregnant. What you need for pregnancy is an estradiol level at a minimum of a 50th percentile. That's going to be a level of 150 or more. For progesterone, remember, you have to ovulate first about halfway through your cycle, and then 7 days post-ovulation is when that egg is actually traveling down the fallopian tube, and that is where conception happens. So in order for conception to occur and implantation to happen, it has to have a rich lining to land in order to grow. That will happen if your progesterone level is high enough. If your progesterone level is too low, you may start the actual implantation process, but it may not be a high enough number to prevent your body from shedding into a period, and there goes your pregnancy. And you don't even know you're pregnant many of those times, or you may have a chemical pregnancy where a positive pregnancy test occurs one day and you bleed and have a period the next. Even if you're doing a blood test, you may show a positive HCG number, and then the next day it's down to 0. So realize that the biggest reason that can happen is because of a low progesterone level. Progesterone needs to be at its 100th percentile level of 20. If you are below the level of 20, infertility specialists will tell you that you need progesterone boosting. However, there are still many unenlightened practitioners out there who don't understand the importance of what progesterone means to a healthy pregnancy and to a healthy implantation. And so you may not even be aware that progesterone is something that needs to be checked. So first and foremost, know that if your levels are not 50th percentile for estradiol and 100th percentile for progesterone, on day 21 of your cycle, which is when you must have that for proper implantation, that it is the low likelihood that even if you have a conceptus, a sperm and an egg that have met and have started to fertilize in the tube, that you may not have the ability for that conceptus to implant into healthy lining in a uterine cavity. So know there are norms. Know that even once you would have a positive pregnancy test, you are not out of the woods. You need to know where your progesterone level is. And even if you had polycystic ovary, you needed progesterone and estradiol to get pregnant, you maintain on those medications, on those hormones, with the help of your doctor checking your levels. We need to get you past the first trimester in order for that healthy pregnancy to stay healthy, allow appropriate growth, so that the placenta can get big enough in the second trimester in order to make enough progesterone to allow you to carry that pregnancy in a healthy manner without taking additional progesterone in addition. So stay tuned for next time at Hey Doc, What's Up? And we'll delve into this topic a little bit more.